Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, diagnosis of hepatocellular carcinoma. Now, how are you going to diagnose the hepatocellular carcinoma? First we will have to see the non-invasive diagnosis. Obviously, in the non-invasive diagnosis, we can do a CT scan can be done or MRI. What do you see in the CT scan or MRI? In the non-invasive test for hepatocellular carcinoma, we will see that if the lesion is focal lesion with 1 to 2 centimeters, then you should do these two imaging techniques, that is CT and MRI are done, and you will see that there is arterial hypervascularization and venous washout is seen in these two techniques. And if the tumor is between only 2 centimeters, more than 2 centimeters, if the tumor is 1 to 2 centimeters, you should do both CT scan and both MRI should be done. If the tumor is less than 2 centimeters, then sorry, more than 2 centimeters, then you should do only one imaging technique with arterial hypervascularity and venous washout should be done. That is, if the lesion is 1 to 2 centimeters, two techniques are done. If the lesion is more than 2 centimeters, then only one technique is done. Okay, this is for diagnosis. Okay, but for screening we can do ultrasonography. With the in the ultrasonography, you will see the hyper heterogeneous lesion. If it is seen on in the liver, then you can suspect hepatocellular carcinoma. Biopsy proof is not required for hepatocellular carcinoma. Now, once you have done hepatocellular carcinoma, found out that there is hepatocellular carcinoma, what do you going to do for the treatment? The treatment is actually, you will have to remove the tumor. So complete excision of the tumor is done either by partial hepatectomy or complete hepatectomy or total hepatectomy. Right, after doing the surgery, you should need a liver transplantation should be done with a curative potential. Okay, if you do a liver transplantation, first you should excise the liver completely, and then you should do a liver transplant is done.
thank you and thank you for watching.